So thank you all for attending here today. I hope you all can hear and see me okay. I'm glad to see there's a number of participants here, and what we're going to be talking about today is heart healthy living. So this is me. Name is Michael Chen. I'm a cardiology fellow here at Good Samaritan Regional Medical Center. Just a little bit about myself. I was born and raised in the Midwest, originally from a suburb of Chicago. I did my undergraduate degree in molecular and cellular biology at the University of Illinois, and took a year off to work, but then went to medical school in Kansas City. Also got a dual degree with the MBA at that time. Um, and then I was fortunate to be accepted to a residency position here at the Good Samaritan Hospital. And after graduating, I took a year and a half or so and worked as a hospitalist in the cardiology department at the University of Washington. And was also fortunate to be given a spot or accepted a spot here at Good Samaritan Regional Medical Center, where I'm currently a first-year fellow training in cardiology. So this is kind of our topic of discussion today, and these are hopefully questions that I can help answer for you all. First of all, what is heart disease? You know, we throw that term around frequently, but what does it mean? And what contributes to heart disease? What are some risk factors for heart disease? And ultimately, how can I or you live a heart healthy life? So what is heart disease? When we think about heart disease, we think about a disease process. There's different forms of heart disease, but when we're thinking about primary prevention and preventing um, a first episode of heart problems, we think about this disease process called atherosclerotic cardiovascular disease, which is a long word, a long name for progressive narrowing of arteries. And you can see here, hopefully you guys can see my cursor, of kind of cholesterol or yellow fat buildup in the lining of the arteries here. And I'll go into that a little bit more detail. So atherosclerotic or atherosclerosis, athero being fatty deposits, as we saw in the previous picture, and sclerosis being vessel stiffening, which I think is an apt way of describing the disease entity. It's the leading cause of death worldwide, and about 1 in 4 deaths in the United States is actually due to this disease process. And I put a star here because that number is unfortunately increasing in this country, which we're attributing to our epidemic of obesity and diabetes. And over $200 billion is lost in annual cost in the United States. And that includes healthcare services, medications, lost productivity. And a lot of this cost is related to uncontrolled risk factors for the disease. So again, I mentioned the obesity epidemic and diabetes epidemic that we're currently facing in this country. So atherosclerotic vascular disease can happen in any artery in the body, but when it happens in our heart, we call it coronary artery disease. So your heart is a muscle. It works as a pump to pump blood to the rest of your body. And because it's a muscle, much like your bicep muscle or your hamstring muscle, it needs blood flow. And it does its blood flow through what we call the coronary arteries. And there's 3 main coronary arteries with a lot of side branches and smaller arteries off of that. But when you get this disease of progressive fatty deposits and hardening of your arteries in your coronary arteries, that's what we call coronary artery disease. And so you see here, we got the kind of 3 main arteries that supply your heart. Your left anterior descending, left circumflex, and your right coronary artery and your left circumflex. And when those build up with plaque, that's when you have coronary artery disease. And the process as to how this happens is complex, and I won't get into the nitty-gritty of the kind of the molecular level changes, but essentially you have progressive cholesterol deposits in the lining of the artery. And then you also have inflammation and hardening of the artery and stress to the artery. And over time, as I mentioned, the artery gets narrowed. And I put kind of a continuous circle here because it's not exactly a linear process. So cholesterol deposits can cause inflammation of the artery, inflammation can cause hardening of the artery, and so on and so forth. They all kind of work together to contribute to this disease. So why does this matter? Well, when you have this narrowing or this blockage in your arteries, it's a potential cause of symptoms. So when your arteries get progressively narrow, and I'll kind of go back to this slide, um, in a normal circumstance, in normal arteries, your artery is not stiff. It's able to move and open and close with different demands of your heart. So say you're exercising, your heart needs more blood flow, your coronary arteries are able to dilate or open up and get the increased blood flow that it needs with increased demand on your heart. If you can imagine when you have coronary artery disease that's narrowed greater than 70%, and you're exercising or going upstairs or whatever your activity is, and your vessel's stiff and it's narrowed, you're not able to get the adequate blood flow that your heart needs with increased demand. And as a result of that, you can have symptoms, chest pain, difficulty breathing, fatigue. Those are symptoms that can be a result of narrowing of these coronary arteries. And besides symptoms, this has other kind of more morbid implications. So you've probably all heard about heart attack or what we call myocardial infarction. And there's different forms of heart attacks or myocardial infarctions. But kind of the classic, most typical um, form of this is when you have this progressive narrowing, this cholesterol deposition in your arteries, and then for some reason, the thin lining of that cholesterol breaks open, and your body recognizes that, thinks, and then subsequently forms a blood clot, which can completely occlude or block off the coronary artery. And in that circumstance, the artery, or the area of your muscle that's getting heart damage or getting blockage, starts to die. And that's when you have your kind of classic heart attack that we need to rush you to get an urgent procedure. So yeah, they can form total blockage of the artery, and that's a bad circumstance. So not only can this disease process happen in your heart, in your coronary arteries, but can also happen in any other artery. So in your brain, that would cause a stroke. In your kidneys, that would cause kidney failure. In your intestines, that can cause something we call bowel ischemia, where you start to have bloody stools, and your bowels aren't getting the blood flow it needs. And it can happen in your arms and legs as well, which can cause some wounds and pain in your arms and legs, and occasionally that would require amputation. Atherosclerotic cardiovascular disease is obviously a very dangerous and expensive and costly problem, but what can we as individuals do to change that? So what causes or what contributes to heart disease? Well, there's a number of risk factors, and some of them are you may have heard of, but smoking is a huge risk factor. And one of the main questions we ask folks when they come in with a heart attack is if they're a smoker, because that increases your risk exponentially. Diabetes, obesity, having high blood pressure or hypertension, high cholesterol, and family history as well. So genetics plays a large part in this as well. As you can see, most of these are things that we can control. We can quit smoking, we can treat our diabetes, we can lose weight, we can treat our blood pressure and cholesterol issues. We can't necessarily change our genetics, but a lot of these are things we can change, or what we call modifiable risk factors. And that's going to be the bulk of my discussion here today. So how can I live a heart healthy life? That's kind of the ultimate question we want to answer today. So the American Heart Association has, on a regular basis, released kind of based on a lot of different research studies, kind of the 8 essential steps to prevent heart disease. And they call it the Life's Essential 8s, and that'll be kind of the backbone of how to live a heart healthy life. So I'll kind of just be going through each and one. So first, I'd like to talk about getting active as one of the Life's Essential 8s. So a lot of times we get people in our cardiology clinic and they ask, what is exercise? How much exercise should I be doing? What's the level of exercise? Is it running? Is running better? Is walking better? Is biking? Should I be swimming? Is playing golf okay? How long should I exercise? And really what we would recommend is either 150 minutes of moderate activity or 75 minutes of vigorous activity. So knowing that, you might ask, well, what is moderate and what is vigorous? What we base that on is something called a metabolic equivalent, so or METs. So at one MET, you're sitting at rest, kind of like I'm doing now, and your body's not exerting itself over its normal metabolic activity. So that's one MET. If we can see in this chart here, moderate activity is considered 3 to less than 6 METs. And those are things like brisk walk, a casual bike ride, yoga, swimming, whereas vigorous is greater than or equal to 6 METs. And those are things like running or biking at a higher speed, more competitive sports, those sorts of things. Um, I included this kind of chart that I put together of some more common recreational activities here. The point being that, it doesn't necessarily have to be just running. So to be active, it's not necessarily, I have to be a runner. There's a number of, I think someone's microphone isn't muted, but um, there's a number of recreational activities that would qualify as physical activity. So I myself enjoy playing golf, and I try to walk whenever I can because that is count as moderate level activity. And some of you may be Peloton users, and that would be moderate as well. If your skiers out there, if you're on a black diamond at Bachelor or Mount or Hoodoo, that would be vigorous activity. So it's not necessarily just fixed to running and biking and walking and those sorts of things. Um, so I just wanted to go over this chart. It may be a little bit confusing, but I think it illustrates some really important points. So what we're looking at here is a comparison of um, the hazard ratio of mortality. So how much your mortality or rate of death is decreased when you compare exercise to not exercising. And we compare that to the amount of exercise, so the hours per week, and the, I guess, intensity of exercise, so the METs hours per week. So if we look at this first part of this graph here, when you just start exercising, so even a little bit of exercise, so let's say 5 MET hours a week, so that'd be a moderate walk, which is a METs of 5, 1 hour a week. So just 1 hour of walking at a brisk pace per week, you already see this dramatic decline in your mortality rate. The point being that even just a little bit of exercise, even if not able to get to the recommended amount, can have some dramatic benefits on your health. And where does this number of 150 or 75 minutes of exercise come from? Well, when we look at the data, it shows that after about 150 to 300 minutes of moderate level activity, the benefit tapers off a little bit. So between those amount of exercise, we have some benefit, but not to the dramatic degree that we see previously. And then lastly, with extra exercise past the recommended amount, there's no increased risks. So I've heard people say, well, my heart only has a number of X amount of beats per lifetime, and I would say that's not true. There's no increased risk, so there's no increased risk of mortality with exercising past what we recommend. So this is a kind of a cheat sheet that you can find on the American Heart Association website. And I'll kind of be including this with every segment here. But I just want to highlight walking more as a really good way to start being active and exercising. And then weightlifting or some kind of strengthening exercises can be helpful as well. Next, I want to move on and talking about controlling your cholesterol, another one of life's essential eight. So, what is cholesterol? Cholesterol is a class of molecules, and it has a variety of functions in your body that are essential. So, that include it. Cholesterol can be made to be part of the walls of your cells. It gets made into hormones that help your body function. It's part of your skin. Um, Unfortunately, imbalance of your cholesterols is heavily linked to heart disease. And typically, your body has its own pathways to make cholesterol, but it does absorb some amount of cholesterol from your diet as well. And it's carried in your bloodstream by, excuse me, a molecule complex called lipoproteins. Um, and so, we hear this term thrown around frequently. I have this amount of good cholesterol, this amount of bad cholesterol, but what does that mean specifically? And that's the lipoprotein, so the form that cholesterol gets carried around your body. If it's a high density lipoprotein or HDL, it gets carried away from your arteries to your liver to become metabolized. Conversely, if it's in a low density lipoprotein, it carries cholesterol to your arteries. And that's where you have the deposition in your arteries, causing the coronary artery disease, and increases inflammation at that time as well. So, in terms of controlling cholesterol, the things that we'd recommend for many of these um, life's essential aids, and you'll see kind of a recurring theme here, but diet is very important. So, um, typically we recommend not avoiding or avoiding saturated fats, and those are usually animal fats, so your butter, your red meat, those sorts of things. And fiber can has been shown to improve your good cholesterol and lower your bad cholesterol as well. And then exercise as a whole can help with your cholesterol levels. But kind of unique to cholesterol is that, you don't know if you have high cholesterol until you check. So, in men in age of 35 to 65 and women from the age of 45 to 65, without previous history of cholesterol problems, we would recommend seeing your primary care provider and getting that level checked. Um, and medications ultimately are sometimes required to reduce your cholesterol levels as well. Sometimes the diet and exercise can only work so much, especially if you have a family history of cholesterol issues. So I just want to briefly talk about statins, mostly because there's been a lot of kind of pushback against this drug class in recent years, and a lot of literature out there suggesting that the benefit of statins might be overstated or that they might be causing harm in some way. But I would almost push back against that pushback and say that statins have been consistently proven to be the most effective preventative drug in cardiology and can reduce your risk of atherosclerotic heart disease or cardiovascular disease by up to 50%. And similarly, they've studied that people who should be on statins where they've had a history of heart attack or high cholesterol, the risk of death is substantially higher um, if they stop taking their statin medication. And this is based on studies for decades of tens of thousands of patients. And that's not to say that that statins don't have side effects. There's certainly side effects that you should watch out for. Um, but I think the research has shown that those side effects are a little bit overstated. Um, you know, Over time, they've shown that there's a 3% of muscle symptoms, which is kind of the most pronounced symptom that we see with this drug class. Um, and they've done some pretty elegant studies that have shown that there's a nocebo effect, actually. So you may have heard of a placebo effect, where you take a medicine and you have some benefit from that medicine that's not um, intended, I suppose. But what they've shown is that people who are blinded to taking statins have less side effects than people who aren't blinded to taking a statin. So people who know that they're taking a statin have a significantly more higher rate of side effects than those that don't know they're taking a statin. I hope that makes sense. Um, so, talk to your primary care provider, get your cholesterol levels checked, and then, have some more discussion there if you do have concerns about if the statin medication is recommended. Um, but that being said, not everyone should be on a statin because there are side effects. And um, so ultimately, reach out to your primary care provider and schedule an appointment and get your cholesterol levels checked. Next, I just kind of want to talk about diet a little bit. And to do that, I think we need to take a little bit of a trip to the Mediterranean. So the Mediterranean diet is what we recommend as a heart-healthy diet. Um, they've noticed that there's less incidence of heart disease and coronary disease in the Mediterranean region, places like Greece and Italy. And what they noticed with that, it was because of their diet. So the diet there focuses on plant-based foods, whole grains, vegetables, fruits, nuts and seeds, and they use olive oil as their main source of fat rather than red meat or butter. Um, and they did eat meat, or they do eat meat, but typically more of the seafood and fish and lean meat, and those are done in moderation, whereas red meats and sweets are only eaten occasionally. And so that's kind of the basis of our Mediterranean diet here. So just some examples. You can see here, you've got a lean meat, you've got vegetables, you've got beans and a whole grain. Again, olives, which are frequently eaten in the Mediterranean, vegetables, this is kind of your healthy vegetable fat in your avocado, whole grain chickpeas here, more greens. Um, and yeah, I think you can see there's just a trend here of greens, vegetables, whole grains, lean meats. Uh, and so some of you may have seen this chart before, but I think this is an easy way to kind of visualize your day-to-day diet and what constitutes a healthy diet. So really half of your plate, well, first of all, it should be limited to one dinner plate, what we'd say portion control. And half of your plate should be vegetables and fruits. Half of your plate, or a quarter of your plate, should be whole grains, like whole grain pasta, whole wheat bread, brown rice, quinoa, things like that. And then a quarter of your plate should be a healthy protein. So lean meat, fish, turkey, chicken, and certainly you can get protein from beans and nuts as well. And that's to limit your consumption of red meat and other kind of trans fatty foods. This is just the cheat sheet. And again, you can find these all on the American Heart Association website if you'd like to reference them later. I'd just like to kind of point out these kind of suggestions. So cooking at home will let you take control of what you consume, and reading and nutrition levels can be a really eye-opening experience to see, how much trans fat am I eating? How many carbohydrates or sugars am I eating? How many calories am I eating in this bag of chips or whatnot? Um, I won't go over these in the interest of time, but these are some other helpful resources. The DASH diet specifically is if you have hypertension, and it's really the Mediterranean diet with the addition of a sodium restriction as well, or salt restriction. Next, I kind of want to talk about is managing blood pressure. So what is high blood pressure? Um, Frequently we say, what is your blood pressure? Well, there's two numbers with your blood pressure. There's your systolic blood pressure, which is the pressure in your arteries when your heart's contracting, when your heart muscle contracts, and then your diastolic blood pressure when your heart's relaxed. So kind of the two numbers that we look for to get your range of what the pressure in your arteries is at any given time. And high blood pressure is really defined as anything greater than 130 over 80. And you're kind of in that risk of high blood pressure when you're in the 120 to 130 range of your systolic blood pressure, your top number. And normal is less than 120 over 80. And to control your blood pressure, you first need to know what your blood pressure is. And so you need to check it, you need to change it, and you control it. And so there's a number of ways you can do that outside of a doctor's office. especially if you have a history of high blood pressure, we highly recommend getting a blood pressure cuff to use at home. Um, as a general, these kind of arm cuffs are more reliable. And that's not the case with every cuff, but it's just typically more reliable than the wrist cuff here. And then you can certainly find these machines at the pharmacies to check your blood pressure there as well. I looked on Amazon. These are about $30 to $50 on Amazon for these kind of home blood pressure cuffs. I'm not sure how much this machine would cost. So once you know that you have high blood pressure, it's important to keep a log of your blood pressure. Because you come to the doctor's office, you're running late, you're stressed out, and your blood pressure is high. And that's not surprising. But we don't want to treat a high blood pressure that's isolated. And so it's important for us to have some more information, some more data points as to what your blood pressure is at home, and not just when you're in the doctor's office. And so that's when we recommend getting the blood pressure cuff and keeping a log. So on this day, at this time, my blood pressure was this. I was feeling these symptoms. Um, and I missed my medication this day. So something like that, where you're taking it on a daily basis to get a sense of your blood pressure trend rather than just one high blood pressure. Because we see this all the time when people come in, their blood pressure is like 160 over 100, and they say, "Well, doc, I just had a stressful day. I was running late, and I just want to work on my diet." Um, but we don't know. We don't know if it was just stress or if it's consistently high at home. And so we certainly recommend checking your blood pressure, especially if you have a tendency to have high blood pressure. So what are some things to prevent or treat hypertension? So kind of like I said, you'll see a trend here, working your diet, the DASH diet specifically, like I mentioned, losing weight, reducing your salt intake. So people who have high blood pressure, we like to recommend just leaving the salt shaker off the table as a kind of very first step. And that way you're not tempted to add additional salt to your meals. Physical activity, cutting back on alcohol. And these lifestyle changes can actually reduce your blood pressure by 5 to 10 points each. So say you have a high blood pressure, you lose weight, reduce your salt intake, you start exercising, that could potentially cure your high blood pressure, and assuming you can continue with those lifestyle changes. But oftentimes, we do have to end up starting medications as well. So again, our little cheat sheet here, it shows you what high blood pressure means, what the blood pressure numbers mean, and then just some kind of general guidelines as to how to treat blood pressure. Moving on, losing weight is certainly something that we'd recommend to live a heart-healthy life. Um, and so outside of kind of cosmetically, I'm sure we'd all like to lose weight and look better and feel better, but they've shown that obesity and also waist circumference are risk factors and correlates with incidence of heart disease. And so people who have BMIs with greater than 25 are linked to have increased incidence of heart disease. And the same goes with people who have what we call central obesity, so more kind of your classic beer belly situation. Um, so BMI or body mass index is not a perfect index. I will say that. It doesn't account for muscle mass and things like that, but it is a way that we can standardize um, patients and get more research as to how obesity and weight contributes to um, heart disease. Um, and in terms of this sort of recommendations on waist circumference, 40 inches in men is about a 40 pant size waist. I had some hard time finding what the equivalent waist or size in women's clothing. I believe it's about a size 16 to 18, but don't quote me on that. Um, and really, weight loss can have profound impacts on things like blood pressure and cholesterol and diabetes, in addition to looking better, feeling better, those types of things. Um, So I want to point out, specifically how to lose weight. As a general, diet and exercise. I think we've all been told that at some point. But I will say that diet has a much more profound impact on your weight than exercise does. Because really it's about the amount of calories you take in and the amount of calories that you burn. So, you can burn 400 calories on a working out or exercising, but if you eat a donut, eat half a burger, you've already in that 10 minutes it took to eat that food, already kind of um, eliminated that hour workout that you did. So eliminating the donut, eliminating the burger, eliminating those extra calories is much more effective in your net calorie balance than exercising. So we kind of have this misnomer of, oh, I just ate this unhealthy food. I just drank a soda, so I'm going to work out more. It's true to some extent, but really the most effective way is to just eliminate that soda, eliminate that donut, eliminate that bagel. And so moving on to our next Life's Essential Eight. And this is new to this year's version. Some of you might have heard a similar talk by Dr. Scholl's last year. And so this is new to the American Heart Association's recommendations as of this year, is to get healthy sleep. Um, So how does sleep affect your health? This is kind of a developing field in medicine as to how sleep affects health. But we've started to link that poor sleep is increases your risk of things like heart disease, dementia, mood disorders like depression, blood pressure levels, cholesterol levels, diabetes, and obesity. Um, Sleeping poorly can increase your risk of these things. It's not necessarily a causative effect, but it does have a correlative effect. And we recommend that most people need around 7 to 9 hours of sleep. And the quality of sleep matters too. So the timing of your sleep, do you go to sleep at a regular basis? Are you going to sleep during the day and then at night if you work a night shift? And then are you rested from your sleep? So those sorts of things matter as well. Um, I just want to briefly also talk about obstructive sleep apnea, which is another diagnosis that we're starting to just have more and more information as to how dangerous and how much it affects your body. And we're starting to diagnose it more and more, just knowing more about this disease. So what obstructive sleep apnea is when your airway begins to obstruct during sleep, hence the name. And so normally your airway is nice and open, but if you are obese, overweight, you have a thick neck, you start to block your airway, and that's when you start to snore loudly. That's when your wife or husband notices that you're um, stop breathing at night. So kind of this gasping or just not breathing for a certain amount of times. Um, and this is specifically linked to a lot of things like high blood pressure. So oftentimes when people have difficult to treat high blood pressure, we want to screen for sleep apnea. It's linked to heart disease, specifically the right heart of your disease. It's linked to abnormal heart rhythms, like something called atrial fibrillation. Over time, it can cause lung disease. And it's also associated with thyroid disease, Parkinson's, kidney disease, ovarian disease. So really, this is linked to a number of organs. Um, and the way that we screen for obstructive sleep apnea is actually a pretty simple questionnaire that a lot of you could probably answer today. So, do you snore loudly? Are you tired throughout the day? Are you able to just spontaneously take a nap at any point of the day? Has anyone observed you to stop breathing or gasp or choke during your sleep? What we call these apneic episodes. Do you have high blood pressure? Is it hard to treat? Am I overweight or obese? And age is certainly a factor as well. And then certainly your neck circumference or your shirt collar size is a risk factor. And then men, as a whole tend to have more incidence of obstructive sleep apnea. And oftentimes people are reluctant to treat obstructive sleep apnea because that requires a CPAP mask that you put over your face and you got to wear it to bed. But I will say that a lot of patients who are reluctant to start CPAP end up loving it because they're rested during the day, they have so much more energy, they're sleeping great. And so I'll just put that little plug in there because there's a lot of people, and understandably so, are reluctant to treat this disease. And I think in our American society as a whole, we have pretty poor sleep hygiene. So high habits to encourage good sleep. I think oftentimes we're on our phones late at night. We drink coffee late in the afternoon. We work late, go home, we're stressed and we eat a lot of heavy foods. So those are kind of things that, especially if you're having difficulty sleeping or having trouble staying asleep, those are things that with kind of easy modifiable things to treat poor sleep. This is our cheat sheet for getting healthy sleep. I think we discussed most of everything on here. Next, I want to talk about is reducing your blood sugar or treating your diabetes. So what's the relevance of blood sugar? Well, blood sugar or glucose is kind of your life's essential building block for energy. So it's the most used source of energy in your body. And on one hand, having low blood sugar can be dangerous and potentially life-threatening. I will say that we rarely see people with low blood sugars unless they're diabetic on an insulin. So people uh, sometimes think that they're having low blood sugars, and it can be the case, but more often than not, low blood sugars are associated with people who have diabetes or on insulin. Um, but conversely, high blood sugar can cause both immediate and long-term negative effects. So in the short term, very high blood sugars can cause things like nausea, vomiting, confusion, fatigue, dehydration. Really high blood sugars can also, in that immediate phase, cause a life-threatening acidity of your blood, something we call diabetic ketoacidosis or DKA. And when your blood sugar is high chronically, and that's when you're diagnosed with diabetes. And so there's two forms of diabetes. There's type 1 diabetes, which is typically diagnosed in childhood, and there's type 2 diabetes, which is more prevalent in adults. And what we're trying to combat these days is the type 2 diabetes because that's more oftentimes related to poor diet and lifestyle. So I'm hoping this will work here. I just want to kind of talk about the link between glucose and insulin and diabetes and what do these terms mean. So hopefully you guys can all see this, but I just kind of want to do an illustration here. So drawing a blood vessel here. And so normally, let's say I eat an egg in the morning. And so you consume food, and that food is metabolized in your stomach, in your intestines, and it gets broken down into glucose. So under normal circumstances, glucose enters the cells so that their cells can use them as energy through receptors. And the way that glucose can enter these receptors is through insulin. So, you eat a bagel or an egg or something, your blood sugar goes up, you have more of these glucose molecules in your bloodstream. As a response, your pancreas secretes insulin. Insulin binds to these receptors and allows glucose to enter the cells where they get used for energy. Now, let's say I eat a box of donuts a day for 10 years and I start to develop diabetes. So what that means is I'll eat that box of donuts and my blood sugar will go up. And your pancreas responds by trying to secrete more insulin. But over time, because your body's in this constant catch up, your blood sugar is always high, your insulin receptors start to become resistant to insulin. So they're no longer accepting the insulin molecules. And as a result, your body has a hard time taking the glucose molecules into your body cells and using them as energy. And so consequently, you have even more glucose in your body, in your bloodstream, sorry. Um, and so it's kind of this vicious cycle of high blood sugars. And so this is type 2 diabetes. This is insulin resistance, whereas type 1 diabetes is a deficiency in the production of insulin. I hope that makes sense. And so that process of having a chronically high blood sugars, that not only happens in your kind of major arteries, like your coronary arteries, your kidney arteries, but can also happen in what we call your microvasculature, so your tiny, tiny little arteries. And the high blood sugar causes inflammation, causes stress on your arteries. And over time, in your kind of major arteries, that can cause the atherosclerotic cardiovascular disease process we talked about at the beginning of the process, at the presentation, and that can cause heart attacks. Your kidneys, kidney failure. But in your really, really tiny blood vessels in your eyes, that can cause blindness. In your nerves, that's what we causes diabetic neuropathy. Um, and your sexual organs, that can cause sexual dysfunction. And then kind of in your very small capillary beds or arteries in your feet, that can cause chronic wounds that can't heal. And if those wounds become infected over and over again, we might think about amputating that leg because we don't want you to die of that infection. And so, there's a lot of effects of diabetes, both on your major arteries and your tiny, tiny arteries. It can cause effects head to toe. So knowing that, what can I do to reduce your blood sugar? Again, diet and exercise is kind of consistent through everything here. But specifically to diabetes and to high blood sugar, is to limit your amount of sugar and carbs. So, if you drink sodas, especially full sugar sodas, that's the first place to stop. And some people's diabetes end up being cured because they cut out soda. So sugary foods and drinks, sodas, candy, juice, sports drinks, those sorts of things. Um, and then carbs as well. When we think about blood sugar, we think about sweets, but carbs um, get digested to glucose as well. So things like your pastas, your bread, your rice, those contribute as well. And stress can cause high blood sugar as well. And certainly if you're a smoker, quitting smoking can reduce your blood sugar. And ultimately, we want to have people have their blood sugar checked. We have a marker that indexes the kind of average of the last 3 months or so of people's blood sugar, something called your hemoglobin A1C. And we can measure that and kind of see what your blood sugars have been the last 3 months. And that's how we screen people and diagnose people with diabetes generally. So highly recommend seeing your doctor to get screened for this. I just want to say that in terms of controlling your glucose, so metformin here is probably the most common diabetic medication, the first line medication typically for diabetes. But what we see here in this graph, and this is comparing the incidence of diabetes, so the percent of diabetes that we see, and they kind of map the effect of these interventions over time. So without intervention, this is your rate of diabetes over time. With metformin, you see here, and then lifestyle changes, as you can see, dramatically improves the incidence of diabetes, even compared to medication. So lifestyle as a whole, diet, exercise, cutting out the sodas, those have a significantly more beneficial effect than medicines. Um, this is our cheat sheet here. I think we talked about mostly everything here. Um, you know, diabetes greater than 126 is, or blood sugar higher than 126 is what we qualify as um, having high blood sugar. Um, I think this is our last life's essential eight, and that's just to talk about tobacco use. If you're a smoker, we highly recommend quitting tobacco. I think, you know, I think everyone by now, to some degree, knows that smoking is bad for you. A lot of times we think about lung cancer and COPD, but studies have also shown that cigarettes contribute to heart disease. So one cigarette a day can increase your risk by 48, almost half, 50%. And smoking a pack a day will double your risk of heart disease. So really, there's no safe level of smoking, even if you're smoking just one or two cigarettes a day, that still substantially increase your risk of heart disease. So we recommend complete cessation and avoidance of both cigarettes and secondhand smoke. So there's certainly medications, nicotine patches, other things um, that we can prescribe to help with quitting tobacco. But I would say that making a plan to quit is also an effective measure. So setting a date is a kind of a very first step, and then telling people so you're held accountable. And whether you want to do the cold turkey or weeding yourself off, but just setting the date, making a plan is very important. And then knowing that you're going to have urges and cravings, and dealing with them accordingly, whether that's with nicotine patches, nicotine gum, or some people like use seeds or chew normal gum as kind of that hand oral fixation that develops with cigarette smoking. Um, and then handling stress, so to not use tobacco as a kind of a way to deal with stress. So So, going back to our original question, how can I live a heart healthy life? Well, I think we talked about all these life's essential aids. You want to eat better, get active, control your blood sugar, control your weight, control your cholesterol, manage your blood pressure. If you're a smoker, to quit smoking, and additionally to get good sleep. Um, but how can I live a heart healthy life starting today? I kind of touched on all of these, but walking and starting to walking is something that you can do today. If you look back at that graph, an hour of walking a week will already reduce your risk of heart disease substantially. Certainly would recommend 150 minutes of moderate exercise or 75 minutes of vigorous exercise a week. And so that's um, a half hour of moderate exercise 5 times a week, or 15 minutes of vigorous exercise 5 times a week. But walking is a great way to start. So you don't need a CrossFit membership or a gym membership or a Peloton or all these fancy machines, a Bowflex. You don't need all this equipment to start having a heart healthy exercise habit. Walking can be really effective and something that many of us, if not all of us, can do to exercise. And I'll add that finding exercise that you can enjoy. Like for me, it's like I mentioned, is golfing, and I enjoy skiing and things like that. I hate running. Um, those are things that will allow you to exercise consistently if you enjoy it, and not have this kind of uh, trough and peak exercise pattern that we often see where people say, "Oh, I need to exercise. I'm going to go to the gym," and they go and they run 3 miles and their body's exhausted and they don't exercise for 3 weeks. So we want to avoid that. We want something that you can enjoy, something that's consistent, something that's not too hard on your body, that you can do consistently over time. Another thing we can do today is to start eating like the Mediterranean. So kind of picture yourself in Greece and think about what I would eat today, or what would they eat? So olives, whole grains, more vegetables and meats, nuts as a form of protein rather than red meat. And in terms of smoking, like I mentioned, set a date and tell your friends. Those are just really basic steps that you can take today to quit smoking. Um, and if you have a history of high blood pressure, if you're on the cusp of having high blood pressure, you could consider getting a blood pressure cuff. Like I said, they're not terribly expensive on Amazon and in your pharmacies. And keeping a log is important as well. Um, and then ultimately, setting an appointment with your primary care provider is essential. Even if you're generally healthy, you don't have a lot of medical problems, just screening for these things, these kind of silent killers, the high cholesterol, the high blood pressure, the high blood sugar. Those are things that your primary care provider can check and potentially modify to prevent your risk of heart disease. So, um, I think we have a few minutes left here, so I'll just kind of open it up to questions at this point. Hopefully, I can answer whatever questions that may come up, but yeah, I'll just open up to the
Um,
floor at this point.
yes, Dr. Chen, there are a couple of questions in the chat
Okay. See, I'll open
from
that up
during
here.
the webinar. And then I also want to let everybody know that there is a survey link that I also popped into the chat that we'd love it if people can fill it out and let us know how they thought it went. But yes, there's a couple of questions there to get you started, and then
Yeah. Yeah, so Chris H at 12:30 or so asked if LDL is causal or related to atherosclerosis. Why aren't we more aggressive at bringing it down earlier and to lower levels? Um, that's a great question. I think that it's a matter a lot of times of checking cholesterol. So um, I think even as on the provider side of things, we probably don't check cholesterol levels enough, so we don't know what people's LDL levels are. Um, and typically, especially if you had a history of heart disease, we like that LDL less than 70. Um, and, people don't want to take medications. I kind of feel that and I can understand that. But a lot of kind of common scenario is people have borderline cholesterol or LDL levels, and they say, well, I think I can do this with diet and exercise. And those are great goals to have, but whether or not that's something that people can consistently do, as, across the population is not, I would say it's not consistently. So, number one is knowing what your cholesterol levels is, and then number two is yes, diet and exercise can reduce your cholesterol levels, and that's very effective in many people. But people oftentimes are resistant to starting medications, especially with all the conflicting information they hear about statins. So that's kind of most commonly what we see is people don't want to be in medicines. They want to do things with diet and exercise, which with kind of unclear consistency and yeah, hopefully that answers your question. Is there a test that can show whether you have coronary artery disease? Some way to measure the clogging? There are definitely tests that we can use to diagnose coronary artery disease. Um, There's definitive tests that are invasive, that we poke a hole in your wrist or your groin and insert a sheath and then advance catheters up to your heart and inject dye into your coronary arteries. And that way we can see how they fill and if there's any blockages. But that's usually reserved for uh, people who were concerned about having heart attacks. Because it's invasive, you have catheters and wires close to your heart, you're injecting contrast that's harmful to your kidneys. So that's kind of, I don't want to say last resort, but we save that for when we really need that. You may have heard about stress tests. That's kind of another screening tool we use. Um, but we usually reserve that people who we think are having symptoms of blockages. So they're not having an active heart attack, but they might have that kind of progressive narrowing that I described and are having this chest pain when they exercise or go upstairs or walk. Um, we don't really recommend everyone get a stress test because they're only 70 to 80% accurate depending on the test. Um, so there's a lot of room for false positives that would lead to that invasive procedure that has risk associated with it. So unless you're not having symptoms that are concerning for blockages, we don't typically have tests necessary to measure or to screen you for blockages. So really, we're talking about primary prevention or preventing your primary or first event of heart disease. And that's where we get to the life's essential aids as measures to prevent the progression of heart blockages. Uh, What time of day should you measure your blood pressure at home? That's a great question. I would say as long as it's consistent, that's the most helpful. So if you're able to take your blood pressure every day before you go to work and in that way you're able to take it every day, that's great. Um, the other thing is being when you have kind of nebulous symptoms or you're not feeling well, that'd be another great time to take your blood pressure. Um, but there's not a specific time of day. Some people who have really labile or up and down blood pressures, we recommend taking it like 2 or 3 times a day and keeping a log so you can see, oh, my blood pressures are high in the morning versus at night. But we want to see the general trend over days, weeks, and months, rather than just on a kind of hourly basis. So as long as you can check it consistently, we that would be great. And usually kind of recommend take a few deep breaths, get a cool, dark room. Try not to take it when you're stressed out or in a rush, and that way you kind of get your baseline blood pressure. Bill Harbeck asked, will a full body MRI show restrictions? I think maybe you're asking about blockages in your coronary arteries or other arteries. The answer is no. An MRI specifically would not show blockages. There are CAT scans where we're injecting contrast or dye into a leg or a coronary artery or an arm or a kidney. Um, but those are usually also reserved for people who are having concerning symptoms because of the risk of that's associated with contrast and the costs. So an MRI and a CT are kind of different imaging modalities that an MRI is better at things certain things in CAT scans, and a CAT scan with contrast can help show potential blockages. And more in kind of a growing field in cardiology is a CAT scan of your coronary arteries, which I think we're working on getting that more implemented here at Samaritan. But as a whole, MRIs would not show restrictions or blockages. I'll just answer. It's Jan Lewis. Her question while Layla or Lila is typing or preparing her microphone. Yeah, it depends. I think if we're thinking strictly about her question is sugar-free sodas worse than full sugar sodas? Um, if we're talking strictly about high blood sugar and diabetes, uh, I would say no. I think the amount of fructose and glucose in the full sugar sodas in terms of diabetes and blood sugar alone is worse than sugar-free sodas. Um, and I haven't reviewed this literature, but I've heard some increased risk of other diseases with sugar-free sodas, whether it's carcinogens or otherwise. I don't know um, that aspect, but in terms of strictly in regards to diabetes and blood sugar, the full sugar sodas are much worse than the sugar-free sodas. Chris has a question. I'll answer Layla's question first because I think she asked first. She asks, do you recommend that males who have a history of heart disease and their family take statins? And if so, what is a good age? I think that's based on their own individualized risk. So the way that we determine who should be taking a statin or who shouldn't be taking a statin is based on your individual atherosclerotic cardiovascular disease risk. And we have calculators that account for your age, your gender, your family history, your history of hypertension, and then your specific cholesterol levels as well. So I am going to kind of deflect on answering that. And I should say that if there is concern to go to your primary care doctor and get your cholesterol levels measured, because we don't know their individualized risk of heart disease without getting that information. I hope that makes sense. So, in terms of easy things, the diet and exercise and the other primary preventative measures that I talked about would be good steps to take until you can check your cholesterol levels. I'm sorry, I know that's probably not a very satisfying answer, but I don't want to speak to someone's situation without knowing their medical history and their specific cholesterol levels and blood pressure and age and those sorts of things. So, Chris asks if I'm a healthy middle-aged person, but my heart sometimes hurts for no reason. Is that a cause for concern? This seems to happen to a lot of people of all ages, less than 30 seconds at a time. Great question. My lights are coming off here. It depends. It depends. Without knowing kind of the clinical context, if your heart hurts randomly without, I'll start with saying what are concerning features of chest pain or heart pain. So what we become concerned about is when your chest pain occurs consistently and more often than not reliably with exertion. So I kind of talked about the progressive narrowing and how a normal artery responds to increased demand with exercise and activity. So when your heart's exercising or you're exercising, your heart's working harder and you have narrowed arteries, that's when you get symptoms. So chest pain that happens sporadically, randomly, without clear triggers, it's less concerning. I mean, there may be something else going on, like a heart rhythm issue or a musculoskeletal issue or gastrointestinal. It's hard to say. But I will say that, people who have consistently exertional symptoms is more of a concern. So, doc, I used to walk a mile every day without any symptoms, but the last month or so, after a half mile, I start getting this pressure in my chest. I start to get more short of breath than usual. That's kind of the concerning situation. I hope that answers that question.
And then thank you so much, Dr. Chen, for the presentation.
Of course, you're welcome. I'm glad everyone could attend, and hopefully everyone is able to glean at least a small piece of helpful information to take away from today.
Thank you.
All right, you're welcome. Everyone, take care.